everyone, welcome to See and Perceive section. Today I will be talking about a topic which is known as care of dead. The topic is arranged under following headings: introduction, definition, purposes, articles required, steps of procedure. So let us begin with introduction. After the declaration of death, it is the nurse's responsibility for the aftercare of the deceased patient and in performing last offices. Last offices relates to the care given to a body after death. Nurses must ensure that last offices practice follows certain guidelines. Every patient is entitled to the highest quality of care. This extends to the deceased. It is an area of care which allows the nurse to show the utmost respect, dignity, and care toward the deceased. Definition: it is the care of body within 30 to 45 minutes following declaration of death by the physician. Purposes: to maintain normal body alignment before rigor mortis sets in, to reduce mental distress of family, to facilitate transportation to mortuary or residence, to prepare the body for organ and tissue donation if applicable. Articles required. The articles used in the procedure are as shown in following figure. Articles for cleansing or bathing of the body: bowl of warm water, soap, flannels, towel, eye care and oral care tray, patient's personal clothing or hospital nightwear, body bag if required, if potential leakage occurs in case of AIDS or hepatitis B patients. Long artery clamp, articles for cleansing or bathing of the body, eye care and oral care tray, patient's personal clothing or hospital nightwear, dressings or bandages. Dressings or bandages if any wounds are present. Property book and pen, non-sterile gloves, aprons, waste bags, clinical and household, sheets for wrapping the body, sharp box, identification label, micropore. Steps of procedure: caring of the dying patient. Steps of procedure: once death is declared by the physician, cover the deceased with a clean sheet. The medical practitioner will confirm death and document this in both the patient's medical and nursing notes. Contact the deceased's relatives, offer support and guidance. Ask for patient's religious and cultural practices. Determine if family wishes to have a priest at the bedside. Assemble all equipment required for the last offices. Wash and dry hands. Put on non-sterile gloves and aprons. Close room door or draw bedside curtains. Identify the body according to agency policy. Ensure 2 clean sheets are on the bed. Lay the deceased onto their back with 1 pillow supporting their head. If required, a rolled up towel could be used to support the jaw. Gently close the deceased's eyes. Remove all bottles, bags and receptacles like urinary catheters, nasogastric tubes, intravenous lines or drainage tubes. Any leaking wounds should be covered with an absorbent dressing and then secured with an occlusive dressing. Covering the puncture sites with gauze and tape, ensuring the sharps are disposed of in the sharps box. For tubes remaining in the body, either remove clamp or cut within 1 inch of the skin and tape in place. Remove soiled dressing and replace with clean gauze dressings. Wash body parts soiled with blood, urine, feces or other drainage and put clean gown on. Apply jaw bandage. Care including shaving, unless requested not to do so due to religious beliefs and customs. Provide mouth care for removing debris. If the deceased has dentures, remove them and clean with a toothbrush and toothpaste and place it back in the mouth. Plug body orifices such as nose, vagina, and rectum with absorbent cotton, followed by non-absorbent cotton. Ears to be plugged only if there is leakage of cerebrospinal fluid, and nose to be packed similarly. Close eyes by keeping wet cotton balls on eyelids. Remove jewelry unless asked not to do so. If jewelry is to stay with the deceased, it must be documented in the property book and it should be mentioned in the mortuary card. Fold hands as in praying position and tie thumb together. Straighten legs, bring feet together and tie big toes. Complete mortuary card and place in plastic cover and tie to the big toes. Place an absorbent pad under the patient buttocks. Brush and comb patient's hair. Remove any clips, hairpins or rubber bands. Account for all valuables remaining in the patient room and label each item. Prepare a valuable list to inventory all items. Return valuables to immediate family members when they arrive or store in locked container or cupboard. Dress the deceased in their own clothing. Document on property book. Cover the deceased with a clean sheet. Place the sheet or light blanket over the body. Body should be completely packed. Place patient clothing and shoes in a labeled bag and return to family members. In case of death of patients with known or suspected infectious disease, body bags may be required. If the body is leaking body fluids that cannot be contained by dressing, a body bag should be used. Complete identification tags and attach one to the patient's ankle. The remaining tag should be saved in order to attach to the outside of the sheet after the body is covered. Arrange for transportation of the body to the mortuary. Carefully transfer the body to a stretcher, keeping the body aligned. Cover with a clean sheet. Close other patient room doors and arrange to transport the body. Remove remaining items and linen from the patient room. Remove and dispose of gloves and apron correctly and wash and dry hands. Gloves and aprons should be disposed into the yellow bucket. Contact designated undertaker to collect the body. Screen off area where the body will be collected. Remove your gloves and wash the hands. Post-procedural steps. Termination of the articles. All the used sponges, dressing, bandages, cotton and gloves should be discarded in the yellow bucket. Towel, macintosh, draw sheets, apron to be sent for wash. Long artery clamps to be put in disinfectant. Water used during washing or cleansing the body should be discarded along with bowls or jugs. Releasing body. Hand over body to relatives after the bill has been settled and the body is dressed in clean clothes. Assist for transporting body into conveyance from mortuary. Replace articles brought back from mortuary after adequate disinfection. Document the nurse record, the date and time of release of the body. Post-procedural steps. Termination of the articles. Releasing body. Legal requirement. Legal requirements. Legal requirements are important in the following situation. If next to kin or relatives is not present at the time of patient's death, unable to contact next of kin or relatives, death occurs 24 hours after an operation, medico-legal case. Thank you.